Hi, I'm Dr. Susan DeCenso Brown of the Touro College of Dental Medicine at New York Medical College. In this video, we will discuss physical and motor disabilities through the lens of cerebral palsy. According to the CDC, cerebral palsy, or CP, is the most common motor disability of children. The name comes from the roots cerebral, meaning brain, and palsy, meaning paralysis. Cerebral palsy causes permanent disorders of mobility and posture. Thus, individuals with CP who require assistance and support for oral home care will often need these supports throughout their lifetime. While symptoms will present uniquely for each individual, CP is characterized by one or more of three different types of movement disorders. These include stiff muscles, referred to as spasticity, uncontrollable movements called dyskinesia, which can include times of very stiff muscles or very loose muscles, and poor balance and coordination known as ataxia. These movement disorders may affect both arms and legs, only one side of the body, or mostly the legs. If mostly the legs are affected, the individual may not require any assistance with oral home care. A good approach when working with any individual is to ask them about their needs and preferences for support. Depending on the type and severity of the movement disorder, they may require anything from minimal oversight while they brush their own teeth to complete assistance with all home hygiene practices. Understanding the person's needs and preferences is essential to developing an individualized oral home care plan. In addition to difficulty with limbs, some individuals with CP may have oral motor dysfunction. Residents with neuromuscular problems may have weak chewing and swallowing muscles that may cause involuntary drooling and difficulty swallowing. Involuntary drooling can be uncomfortable for the resident, especially during brushing teeth, which can be messy. Complete the routine over the sink. If this is not possible, work over a bowl and have extra towels for dabbing drool and toothpaste away from the mouth during brushing. With increased drooling, residents are at higher risk for a fungal infection at the corners of the mouth. If you notice redness developing at the corners of their mouth, it should be evaluated by the resident's dentist. Swallowing dysfunction also can put an individual at risk for aspiration, whereby food, fluid, or other material enters the individual's airway and lungs. Aspiration of foreign material into the airway and lungs can have serious consequences, such as choking or pneumonia. If a person under your care is on aspiration precautions, it is advised that you include their physician and dentist in developing best practices for oral home care. They can recommend adaptations specific to the individual, which may include ensuring the individual is upright and minimizing water use. In severe cases of aspiration risk, an individual may be restricted to nil per os, nothing by mouth, or NPO precautions, in which case they receive their nutrition by non-oral means, such as through a tube directly into the stomach. People who are NPO still require daily oral home care routines and regular dental checkups. Additionally, individuals who do not eat by mouth typically have a higher risk of developing tartar, otherwise known as calculus, which is a hardened debris that cannot be removed from teeth with a toothbrush. If not managed, tartar can lead to progression of gum disease. The gag response can also pose discomfort for the resident and challenges to oral care. For residents with hyperactive gag reflexes, place the toothbrush and floss gently into the mouth, starting with the front teeth. Allow breaks as needed. To further minimize gag reflex, keep the resident's chin in a neutral position or tilt it downward during the brushing and flossing, allowing for spitting excess saliva and toothpaste throughout the routine. Some residents may be prone to falling or accidents and are at risk for trauma and injuries to the mouth. In the event that trauma to the mouth occurs, caregivers can help by locating missing teeth or tooth fragments. These can assist with dental repair as well as potentially avoid the need for chest x-rays if all pieces are accounted for. In any case of trauma, be sure to contact the appropriate medical professionals to evaluate the resident. A successful oral home care routine is an essential part of preventing progression of oral disease and tooth loss. The oral hygiene routine should be as comfortable as possible for the resident. Details such as the location, time, and position should be explicit, and consistency is the key to developing good habits. When working with a resident, caregivers should ask them about any challenges and ask to assess their completeness of oral hygiene practices to determine whether assistance is needed or preferred. For those who have the ability to practice oral care on their own, caregivers should continue to encourage good oral hygiene habits and proper brushing and flossing techniques. Residents with hand dexterity issues may have difficulty brushing and flossing independently. In some cases, oral hygiene tools can be adapted for easier use by the resident on their own. Some examples include using a tennis ball to adapt the toothbrush handle, or a rubber band to secure the toothbrush to the handle. Also, consider electric toothbrushes instead of manual, and floss holders to assist with dexterity issues. In other cases, the resident might need partial or full assistance of the caregiver to brush and floss. For an in-depth discussion on assisting for effective brushing and flossing, see our Smiles United lessons, Oral Hygiene Instructions for Caregivers, and Troubleshooting Common Oral Hygiene Issues. Additional support may be required for involuntary movements. For residents with uncontrollable body movements, caregivers should do their best to help the resident relax. First, ask the resident, then place gentle but firm pressure on the individual's arm if it begins to shake. This type of pressure can assist with calming some movements. Gentle head support might be helpful to stabilize the resident for successful oral home care. Be sure to guide them slowly and gently and include verbal cues and instruction. Take breaks as often as necessary during the oral hygiene routine. These interventions will not necessarily stop the uncontrollable body movements completely, but can help reduce their frequency or intensity. Good oral health has profound physical, emotional, and social effects on an individual's life. The relationship between the direct service provider and the resident has been shown to be an important factor in maintaining good oral health. It is important to show respect to those you are working with and be patient when you are monitoring or providing physical and verbal prompting. Physical and motor dysfunctions similar to those discussed in this video can be associated with several disabilities and disorders in addition to cerebral palsy. Strategies discussed in this module may be appropriate and helpful with individuals without cerebral palsy presenting with similar physical and motor difficulties. In any case, do your best to develop trusting communication, both verbal and nonverbal, with the resident under your care to develop an individualized oral home care routine. Discussion of home hygiene routines with the individual's dentist is always recommended. When we take a collaborative approach, it enhances the success of individualized brushing and flossing routines and can aid in overcoming many of the physical and motor barriers that may exist. Thank you for watching this lesson of Smiles United with Touro College of Dental Medicine. Be sure to view our other lessons for more information.